India has expanded its vaccination drive for Covid-19 to teenagers from 15 to 18 years of age. The push comes as the country braces for a third wave driven by the Omicron variant, and Indian cities impose fresh restrictions. Anjana Pasrika reports from New Delhi.
There was enthusiasm and a sense of relief as India began vaccinating teenagers, 15 to 18-year-olds, for Covid-19 this week.
I
feel confident that with the vaccine, I feel I can go out. When I went to school, I used to feel so scared that I may fall sick and carry the infection to my parents and neighborhood.
The inoculation drive for youngsters began amid an exponential jump in Covid-19 cases in mega cities like Delhi and Mumbai. The looming third wave of the pandemic due to the Omicron variant has created fresh anxieties in a country where school closures lasted for nearly a year and a half, longer than in much of the world. But just months after resuming in-person classes, schools have again shut.
Online school, it gets lonely and all, so schools being in person is always much more fun and everything, so I'm looking forward to it when it's safe.
Calls have been growing to protect youngsters in a country with the largest adolescent population in the world. Two-thirds of India's adults have been fully vaccinated, while 90% have received one jab.
Sooner or later, a wider population need to be vaccinated, especially in a context like India, where adults constitute only 63% of the total population, unlike some other countries such as Europe and other settings where adults are around 80% of population.
The ramped-up vaccinations are raising hopes that India will not experience the devastation triggered by the Delta variant last year, when hospitals were overwhelmed and there were crippling shortages of oxygen. At that time, much of the country was not vaccinated. This time, experts expect less pressure on medical services.
Unlike Delta wave, where high proportion of individuals who were detected to have infection would require hospitalization, oxygen, ICU, etc. In Omicron, with the current evidence, it says that infection is mostly mild and severe disease is mostly linked to the pre-existing high-risk condition or unvaccinated individual.
That's raising hopes among some students yearning to get back to a semblance of normalcy.
I was bored sitting at home. It was really nice when we went back to school, and it was so difficult to study at home.
I want schools to reopen so that I can again get back into the habit of studying.
In India, school closures due to the pandemic have affected nearly 200 million children. Anjana Pasrika for VOA News, New Delhi.